Hello and welcome to the ARIS Training Module 1, Session 4. This last session in Module 1 is a deeper dive into the guiding principles behind the ARIS curriculum resource. We will take a closer look at the modernized approach to applied behavior analysis, the whole child development movement, and the assessments and standards which the creators incorporated into the design of this resource. Hopefully you've gotten the chance to open up and look through your big green tubs. Locate all of the language builder cards, the manipulatives, matching kits, your 2 boxes of lesson plans, the reproducible activity sheets, and the detailed implementation guide, which not only includes helpful information for the ARIS implementation, but also includes reproducible versions of data keeping sheets, home communication sheets, assessment and progress tracking tools, and behavior management tools and resources. It is important to note that the kits are organized in a way to save space for all of the materials to fit into the 2 green tubs. And so it is possible, if teaching lesson 1, materials that you need may be located in green tub number 2. ARIS was designed with students with autism in mind, but it can be used with other students who may benefit from a more personalized early education program, as the lessons follow a logical progression which covers skills critical to the academic and personal development of all students. Lessons may be best suited for students whose skills are developmentally in the pre-K to early elementary range, and can be used with older students depending on the need or developmental level. ARIS joined together the principles of applied behavior analysis and whole child development and aligned all of the content to the most commonly used assessments and standards. To help you understand the logic behind the ARIS program, it helps to review some of these guiding principles and standards. As noted before, one of the principles guiding the development of ARIS is applied behavior analysis, or ABA for short. ABA terminology is used in the lessons, and you might hear these terms used by visiting professionals or in conversations with the families that you serve. So it's a good idea to have a basic familiarity with the concepts. ABA is a type of therapy based on the application of science to learning and behaviors. It's a set of principles that focus on how behaviors change or are affected by the environment, as well as how learning takes place. We know that children with autism and other students that need specialized instruction may learn differently, which is okay. Many children learn social and developmental skills by observing and interacting with other adults and peers, but children with autism may be less likely to acquire these skills just by observing. ABA uses predictable and repetitive teaching for children who need that routine and structure to learn. Research shows that ABA therapy can significantly improve the academic performance and functional behaviors of children with autism and related learning challenges. ABA can be used to foster basic skills such as listening and imitating, as well as more complex skills such as reading or understanding another person's emotions, responses, and behaviors. As children learn how to respond and interact with the world around them, these newfound skills can help reduce inappropriate or challenging behaviors. For example, when a child learns how to communicate their needs and wants, there will be a decrease in frustration and inappropriate conduct. The vocabulary and ability to a request will replace the negative behaviors they previously used to get their needs met. ARIS is not designed to replace the many years of study required to be a licensed ABA therapist or registered behavior technician. ARIS is designed to make the strategies of ABA accessible and easy to implement by educators who don't have formal training. The lessons in ARIS are presented in the style and organization that you will find in a typical ABA program, so it will be helpful to know some of the basics of ABA as a foundation. With this background, you can then bring your own personality and teaching style when you use the lessons in your classroom. ABA focuses specifically on discrete trial training, or DTT for short, and the ARIS lesson procedures follow this technique. One of the most useful components of ABA-style teaching is that it breaks complex tasks down into smaller, more manageable steps that can be taught one at a time until students gain confidence. These tasks are then strung together to build more complex skills. Students benefit from the structure and finite details in the ARIS lessons, whether or not your school or classroom exclusively follows ABA methodology. ARIS is also guided by whole child development. The Whole Child Initiative promotes holistic student development and success, ranging from academic readiness and critical thinking to social and emotional wellness. The goal is for children to make meaningful and lasting gains, not just perform well on a specific task. ARIS targets full child development in multiple ways. First, ARIS covers 7 content categories which focus not only on academic skills, but also on learning readiness, as well as communication, social, emotional, and functional life skills. ARIS includes positive behavior management tools to address challenging behaviors, which can interrupt learning for the student and an entire class. ARIS lessons include both structured and playful ways to teach skills and concepts. Many lessons involve peers in the learning to improve social-emotional development and increase generalization. It is also important for a student with special needs to have every member of the education and care team working together, so the diverse needs and challenges are addressed cohesively. And as we'll discuss in a later course, ARIS has all the tools to help families and educators communicate and make sure they are teaching the same things at home as they are at school. The third guiding principle is alignment to standards. The lesson categories and the specific lessons in ARIS were chosen based on commonly used educational standards and assessments. These include the Assessment of Basic Language and Learning Skills Revised and the VB-MAP, which are 2 common assessments used with children with autism spectrum disorder. The standards also include national and state-specific educational standards. The lesson progression follows a path based on those standards and guidelines. Because ARIS lessons are aligned to the APLS-R and VB-MAP, if a student's records already include one of these common assessments, placing students in the initial ARIS lessons will be easier. Conversely, tracking student progress through ARIS will help you update the APLS-R and VB-MAP. Your ARIS kit includes a wall poster laying out the alignment of ARIS lessons to standards for easy reference. Standards can also be found on the individual lessons, in the implementation guide, and on the ARIS user portal. You have now reached the end of Module 1. Next up, in Module 2, we'll find an overview of how to get started with ARIS right away in your classroom. We are excited to continue this journey with you as you learn more about the ARIS resource and all the best teaching practices that will help you and your students learn and thrive.